Our passion didn't start with the mouth. It started with people, with the well-being of the profession. And if you're like me, maybe a little bit of your nerdiness and all things tech too. We all want to love what we do, but the truth is, burnout, people problems, and glass ceilings can keep us from doing what we set out to do. So let's get back to the heart of connection. Welcome to the Dental Handoff. This show is about passing you the knowledge, the habits, the systems, and the strategies to lead your teams, lean on your tech, and listen to your gut while you take care of people and truly the overall health of our communities. Let's stop using the wrong end of the toothbrush, y'all. My name is Dr. Kelly Tanner. Oh, and uniquely, I'm a dental hygienist too. You can consider me a guru in the dental and leadership industry. With over 3 decades of experience, my goal is to take you to the next level by empowering growth, perspective, and confidence. By identifying the gaps, recognizing the plaque, and extracting the truth with the other experts in the field. I'll share their stories, empower you to own yours, and elevate your passion in the process. So have a seat in the chair, put on your bib, and let's get to work. Hey, welcome to the Dental Handoff. This is Dr. Kelly Tanner, your hostess. And today I have with me Machell Hudson. Machell, it's so nice to see you, my friend.
It's so fun to be here. And what a fun honor it is to get to talk to you for a little bit and share. So thank you.
Oh my gosh, the honor is all mine. Machell and I were just talking about, of course, you know, how we're always like the 2-second, hey, we'll talk to you soon at conferences. And here we are, we get some quality time together and share her story with everyone. So Machell, I always start with a question. Why dentistry? Why dental hygiene for you? What's your story?
It was actually, I was forced into it. So our Heavenly Father said, this is what you're going to do. And I said no for a really long time until I couldn't say no anymore. In high school, I had a friend, Rachel, who was going to Texas Women's. And she was like, Machell, you should, because I was obsessed with smiles. And you didn't even have to have like a perfect smile, but I feel like a smile, even if you're missing teeth, but a smile is really the most beautiful thing that a human can wear. And you know when it's genuine, you know when someone's hurting and they're forcing a smile. And so it really tells you a lot about a person. So I've really been obsessed with smiles my entire life. But to be a dental hygienist, I thought that was the grossest thing in the entire world. There was no way I was going to, and this is like for anyone who knows me, there's no way I'm going to clean teeth for a living. This is me in high school. And now it's like, if you even say anything and call it a cleaning, like my, it's like nails on a chalkboard for me. So fast forward to when my son was little, I knew that I needed a career that was going to allow me to prioritize being a great mama. And it really was. I would go to stores like concerts, and I would be asked all the time, are you a dental hygienist? Are you a dentist? And I'd be like, no way. And so it was kind of like, that's something that I should consider. And so I did. And from the moment that I committed, y'all, I have been so passionate, and there has not been 1 second, Kelly, that I have not been in love with what the Lord has blessed us to do for a living.
Oh, that's powerful because you get to, I really feel like we get to change lives, don't we? And that's what I knew about the profession too. I'm like, I can touch people's lives where they are, not that their smile, like you said, to your point, has to be perfect, but to ensure that they have that opportunity to have the smile for them that makes them have that confidence, that psychosocial connection that is the first thing a lot of people look at, right?
So it really is. And I cannot remember the study. I have Googled it. I've gone to like all the peer review. Like there was a study that was done, and I read it a very, very, very long time ago, maybe even 20 years ago, where they did a study, and half the group, they did like Botox and fillers, minimal like skin improvement. And then the other half they did, they focused on the smile. And then they did a survey, who is more beautiful? And guess who was more beautiful?
Hmm.
Those with a beautiful smile. And which that doesn't surprise us because we know how beautiful and magnetic a smile can be. And so I agree. Not only are we changing lives, we're improving quality of life. And many, many times we have an opportunity to save lives. And that's really the missing puzzle piece for so many, not only within dental hygiene, but also our dentist. You know, I used to, there's this, they had it on the American Academy for Oral and Systemic Health website for a while and in social media. I was talking to Chris Kammer, and one of the things as a new speaker and consultant, I would go in, and one of the things that I would ask is, tell me what it is to be a dental hygienist. And it was very common to hear, well, I'm just a hygienist. And that is heartbreaking to me. Just like, what an insult to who you are. And then Chris Kammer said, we all love Dr. Chris Kammer. And he said, I want you to start asking dentists that, Machell. And do you know how many dentists that I had tell me, well, I'm just a dentist. And so I was like, oh, like our profession doesn't even know how special it is. And our role in whole body health, like we're healthcare providers, that you are not healthy unless you have a healthy mouth. It's impossible. And it's often, it's a missing piece. So
it's a
I
huge
think I
part of it.
ventured off. Yeah, it
No,
is.
not at all. This is totally relevant because I mean, this kind of gets us to where you are today and what drives you and what's your passion and your why, some of your why, because so you started off in clinical, I'm assuming, as a clinical hygienist, and then where did you go from there?
So I have to talk about being within the clinical space because I'm not, there's so many people in this oral and systemic space that practice oral and systemic health. There's a lot in this space that are educators, but have not had the opportunity to actually have an incredible amount of time practicing as an integrative hygienist or an integrative dentist or assistant or admin, just so you know, because everyone is valuable. There is no one better than another in our practices. I took a job for doctors Bruce Baird and Jeff Buski, and in 2007, wasn't looking for a job. My friend Sammy Blake was actually like, oh my gosh, Granbury Dental Center is hiring. I had just moved there a few months prior, and I was driving back and forth about an hour and a half. And I had a son that was in baseball and basketball and tutoring a few times a week. And I was also this a loyal dog and was never going to leave my dental practice because I was very happy. I was a lead hygienist and just really loved my patients and the people that I was blessed to work with. But she begged me to call this practice because she was like, you have no idea, they treat their hygienist so well. And I was like, okay, I promised her. And so I won't break a promise. And so I called and I spoke to Cynthia Baird, Bruce Baird's wife. And I knew within 10 minutes that I was going to take that job. We talked for an hour and I went into the practice and toured. And I'm like, holy smokes, what's going on in here? And because it was different. And then as I started working, so we are all very familiar with sleep disordered breathing, obstructive sleep apnea, and being a part of a sleep practice now. At the very least, we're going to be screening. We should be screening. Yes. But this is before, like, you didn't go to a dental conference 16 years ago and hear someone speak, unless you went to a niche conference like FAAOSH and hear about sleep dentistry. You were going to these little, these small meetings like Dr. Hang or Michael Gelb. And so I was like, I'm in this woo-woo, like freaking practice. So we were screening for airway. We were treating sleep disordered breathing in pediatric and adults and obstructive sleep apnea, upper airway resistance syndrome. And it was the scariest thing in the whole world. The way that we were treating our perio patients was completely different than what I was taught in school and how most practice today. And then we were talking about systemic health. And so I really thought I was in a crazy place, but I really liked these people and I didn't want to leave because they were so much fun and they were allowing me to learn. And the patients, I quickly became addicted to hearing this was a normal, which is a very abnormal. So like dental teams are used to hearing, you're the best hygienist I've ever had. You're the best dentist I've ever had. You're so sweet. But what we would hear under that roof was, I've never had an exam like this before. I did not have any idea that I was slowly dying. I did not have any idea that I wasn't sleeping. My physician is so grateful that I met, like, it was like, this is the best, you saved my life. Dr. Baird saved my life. No. Jeff Buski saved my life. Machell, you're saving my life, because we become a part of that. And our assistants are a part of that, and our admin. And so it's like, you take this, it was a risk factor, and we all know risk factors. Coyce teaches it, Spear teaches it, Dawson, and you go and you learn from all these brilliant programs. And then you kind of like put all of those pieces together, what works for your practice, for your patients, to elevate that patient care. And in the midst of this, Dr. Bruce Baird, he's also the co-founder of Productive Dentist Academy. And so for about 8 years, he was like, would always compliment how great of a hygienist I was, how good I was with my patients, how I loved learning. Cynthia was very complimentary, and so was Dr. Jeff Buski. But I didn't want to be anything. I didn't want to be anything but a dental hygienist. That patient care, you're obsessed with it. Like, all I ever wanted to be, Kelly, was a part of something bigger than me and being able to nurture and love people really well. I never needed to be on stage and be I actually don't like a lot of attention on me, but I'm also super passionate, and you don't have to worry about wondering what I'm thinking. So it was really, you're that way too. You have that disease too. That's why you're laughing.
I do.
And I'm obsessed with people that are like that. Like, you don't even have to agree with me. I appreciate the challenge, like, okay, challenge my belief. But I have to be allowed to challenge yours as well. And we get to grow together. So it was really 2016. I went to, Productive Dentist Academy's Blue Sky event. That's when they take their clients and they bring in some of the best speakers. And so I got to learn from Dr. Kim Kutsch. I went so that I could learn from Dr. Brad Bale. It was my son's senior year. I was a crazy person that year, because one day I'd cry all day because my baby was going to leave after graduation and never come home. We have that weird feel. Like that we were going to lose them forever, which does not ever happen. At least I'm blessed that it didn't happen, because my baby and I are like this. And it was at that meeting that Bruce and Cynthia and Susan Lekowitz were like, Machell, it's time. Stay clinical, but it's time to start sharing your love and how you can provide elevated patient care. And I was like, nope. But I went and I really took that to heart, because I don't know how you feel, Kelly, but I really think that when you have the people that love you the best, and even people who may not know you that well, but they see something very special in you, because we're our worst critics, right? So we don't see it. I didn't think I was doing anything more special than anyone else. But I had these friends, these family, it felt like family, that believed in me. And so I said yes, because they believed in me. And so that's when I took action and started working. I was able to work with Patty Suey and Catherine Gilliam, and I love both of them so much. And everyone know, I mean, I think everyone knows Catherine Gilliam. She is just this, she has this sweet little like voice, and she's just like this precious human. But y'all, she has so much passion exuding from her, and she's so smart. We created this really sweet oral and systemic foundational, and then a level 2, which was more oral systemic advanced protocol for PDA. And from that, I was at Voices of Dentistry and did a podcast just after that with Machell and Andrew, who quickly became one of my besties. He didn't know it for a while. It took a while to convince him that we were like best friends, he and his wife. And, but they get it now. They got it. But Andrea heard me on that. You want to know what that podcast? It was so funny. So when I would talk to them, or anybody for that matter, outside of being off camera, it was so easy. But as soon as they hit record, I don't even like, I just was really quiet, and everyone knows that I'm not ever quiet. And I didn't even know how to answer some of the questions. I was like, I don't even know what my name is right now. And
you froze. Mentally froze.
I did. And so as soon as they hit stop record, I went back to normal, and Andrew goes, oh my gosh, where was this girl during those 45 minutes? And I was like, well, you shouldn't have let me see the record button on. So anyway, I now have my own company, Integrative Dental Coaching. Andrea Johnson heard me on that podcast and convinced me to create one presentation. I spoke it in January 2019. I thought it was going to be a one and done, but she's another one of those amazing forever friends that saw something in me that I did not. Here I am speaking around 40, right at 50 presentations a year, and never, ever thought, like, my dreams weren't big enough, Kelly. Like, how about you? Are your dreams, were they big enough? I bet they weren't big enough. I bet you had no idea that you were going to be as impactful within our profession and healthcare as what you have become. Or maybe you did. I certainly didn't. I wanted to love one person at a time and quietly be impactful.
Yeah. And you were doing that. And so backing into that story a little bit, Machell, because you're talking about it in a linear fashion, but it doesn't really always happen like that. Like, there is like self-doubt. There's all this stuff like, you're scared. It's horrifying to think that you're going up on stage and talking about what you did. Am I good enough? And the self-doubt and the imposter syndrome and all of those things. And then to talk about it like, oh yeah, then I just do 50 presentations a year. I mean, you're back, right? And so backing into it, you went from this individual who thought that this was a woo-woo office, not really sure what you're walking into, realizing for yourself that you were changing and saving lives, that then someone else saw in you, that then you were on stage and doing podcast and sharing this message, now sharing your methodology, what you're doing, what you know with other people, to create this ripple effect in other people's lives forever, in perpetuity. So, what got you in that comfort zone? Like, why? I mean, like, why did you decide to just go for the next step and go for the next step and just stay with it and not be like, I'm freaking out, I don't want to do this?
It really is the people that I have been blessed with. It becomes addictive when you start hearing. So I tell stories all the time about my patients that I was so blessed at playing a role in their healthcare journey. Our patients trust us, and they tell us the good, what's going on great in their life, their losses, the heartbreak. And then there's like, when we get to be really real with our patients, this is your disease. Our responsibility is to share their disease state, their responsibility. If we know how to communicate, their role is to accept that responsibility, and we guide them. We're a part of that journey with them. And I kind of felt like that, the people that were put into my world, I mean, I pinch myself all the time. How do I get to call my friends, like, these are some of the greats in our profession and all of healthcare? And how do I get to sit on the board? I'm the only hygienist on the board of the American Academy for Oral and Systemic Health, made up of physicians and dentists.
Amazing.
And we do have one MBA, and grateful we have to have those business guys and gals, but they believed in me. And so it's that same thing. Like, I share, like, I love how you summed me up in like, 20 seconds. And I need you with me all the time. You can be my interpreter. Okay. So what she just spent 10 minutes telling you, I can do 1 minute. So because people believed in me and I share thoughts, I'm very creative, and I'm always thinking how we can do systems better to better educate and elevate care. And in short, people like held my hand. I was scared to death. And it's so much easier, in my opinion, to run away and hide under a rock, because people only remember you for about that long, because someone else has come along, unless you were truly impactful in their life. And so there were all these greats that have turned in, that these greats that liked the knowledge that I had to share, because I truly have been practicing oral and systemic health. I get to do all the things. The only thing I haven't done is ozone. I haven't worked in an ozone practice. And so that's the only thing. And so I don't speak to ozone because I don't know ozone. That's another thing people know about me. I'm not going to speak to something that I don't have experience with. But because people believed in me and they wanted me sharing, I couldn't say no. But I had all of those things, scared to death, and it would have been easy just to walk away. But you get these emails, these phone calls, because I always put my phone number on my slides, and, call me, lean into me. And then, like, the hygienists that I'm so blessed to, doctors that I'm consulting with, I'm there for their hygienist, but I teach the whole team because we all have to speak the same language. We want to collaborate with physicians or medicine, all of the medical healthcare profession. Well, guess what? We have to learn how to communicate and collaborate within our own space first. And so I just feel like hearing this, Machell, like, front office to the back office, because of what you shared with us, this is what we were able to do for our patients. And I love these stories. I had a story from one of my hygienists last week where she had a patient that high blood pressure is a topic that we could spend an hour talking about. But she got really teary-eyed, and because she knows that she saved his life. And he listened. And we are not teeth cleaners. We're not drill and fillers. We are healthcare professionals. And I do have when I started doing this, Kelly, I was like, it was about teaching people the opportunity and the protocols and what's the average diagnosis of perio in our country. Let's start there. We want to do all the things, but we're not even diagnosing a very serious disease.
Yes.
And so it was really to go in and help people with protocol, risk factor, P4 method. And what came out of it was so much more. It was the empowerment piece, and seeing people that were ready to leave our profession because they didn't see purpose in it, when our purpose is so big. So you don't leave. When you're assigned a purpose. You don't leave until that purpose has been used up and there's a new purpose that follows.
I love
that. That was very wordy.
So much. Yes, because I think that, from a young age, you probably didn't even realize, we don't realize a lot of times, like, what it's going to look like, our purpose. We know that we love people. We know that we want to connect and make a difference, but then you actualize it differently based on what's falling into your life and about what you have heart for. Right. So, I mean, it sounds like that this gives you such a big sense of purpose to be able to do that. And then what we talk about so many times, and is that so many times it's what others see in us to help us self-actualize, like, are they true? Like, for real? Me? And like, could that be true about me? And it's so wild because I think it's also too important for us when we see that in other people to also give that power to them to say, hey,
Always.
what I'm noticing is this. And do you know how valuable that is and how valuable you are to this profession because of these characteristics that you have that you could then share?
I love that you brought that up. I think it's really, really important that, first of all, to have that like grandioso type of attitude, like I'm the best, I'm doing this and bragging. None of us are any better than anyone else. And really, it really has been the opportunity to work for Bruce and Jeff, and then the opportunity to learn from Kim Kutsch, Susan Maples, Doug Thompson. It's like my opportunities have been blessings that really I feel like, fell from heaven. Like it was part of my journey. Every single team that I work with, every single member of that team, I'm a big believer. So even like everything should be, there should be a connect and a celebration. And so strength finders, and Duffy's a big strength finders. My number one strength is positivity. And so it's funny. It's like, oh, my life makes sense because I've because I really lead with that. And negative energy for too long, those that don't have, like, they don't see the good in every day, even on our worst day, there's so many things to be thankful for. And I really am that type of person. But it's like, I think it's important when I go into teams and this is what you do. So I'm not looking at what they're doing wrong. I'm looking at what they do really, 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 really well and in the most beautiful way. And then how can we work together to build on to their greatness? And that is even in those teams that have no idea, like they have forgotten how to diagnose perio. When they're looking at caries, it's like one tooth at a time treatment. It's not connecting. It's caries disease. This is a disease too that affects systemic health. And then they have no idea how to even talk about sleep. But I'll tell you what, they hug their patients as soon as they see them. And you can tell because that gentle gesture when they put their hand on their hand and how have you been? It's like relationship is the most beautiful thing that we can offer as a human being, and caring and loving people right where they're at. It's our job to celebrate those things with our healthcare profession because it's very broken, and then build onto that. And seeing these hygienists evolve, I've never worked with, I take that back, one team that we did not greatly increase all of their percentages if you want to look at metrics. And I don't lead with profitability. It is a bonus, Kelly. How do we elevate? How do we empower these teams to know that they are amazing? Because anybody that has chosen healthcare as a profession, you are an angel. You just have to know we need to empower, and we really need to instill a confidence within the dental profession, everyone, and even medicine. Our patients, do you know how we instill the value? So if we're valuing the financial piece, guess what they're going to value?
Right.
However, if we value and we truly are valuing relationship, then we are comfortable talking. This is your health state, and this is what we can do together to help get you healthy. And I think I got off on it. It's tangent, but that's
No, but
where I'm
that's,
kind
I
of
mean,
at.
that's what leads you. I mean, that's what
Mm-hmm.
drives you. That's your purpose, is to also teach and lean into other teams to say it's never, and I consult as well. And hygienists will come to me and they'll say, I feel like that some of this can be just about the money and the profitability. It's like, it's never about the money.
Mm-mm.
I mean, that's just a byproduct of what happens. But you know what I'm saying? It's like if you take care of yourself, you're going to spend less money on doctor bills. So
Mhm.
if you take care of the issue, which is your patient, they trust you to tell them
Mhm.
what it is and give them that power to make decisions, then that's what it's about. It's that connection and saving lives, because then you
Mhm.
are leading them down the right path. And when I say that to the hygienist, I think sometimes they're like, I don't know if I believe her. But then as we get to know each other over the next few visits, it's like, okay, she is talking, she's walking the walk and talking the talk.
Yep.
But it's always about that relationship and being there and serving, because it's an act of service from us, those angels that you talk about.
Servant leadership.
Yep, always. And
Mhm.
so it sounds like that, it's so good, Machell, to know that other folks are out there and singing the same tune. And, if I don't, we talked about this before we hopped on the podcast, but if I don't know, one second, my system is updating. Okay, I'm gonna stay still. If I don't know what to say or how to answer a question, I am always going to say, I do know someone who has that expertise
Mhm.
and that knowledge. And I will hand them to say, talk to Machell, talk to this. So that's an opportunity for all of us to build a collective we up in this industry. So it always warms my
Mhm.
heart to talk to other consultants and people just making a difference, which is basically everyone who's on this show, because it just does. It just reinforces that we are all together and we are a force to be reckoned with. And because of
Yeah.
what we believe and how we are making a difference in what we're doing. So thank you for all that you do every day.
Thank you. Thank you for what you do every day.
Oh,
It's
well.
very special.
Well, thank you. And Machell, our time, it's just gone by so fast. And I just enjoy getting to know you. And I know that you have a website and everybody had to contact Machell is in our show notes. But Machell, are you going to be anywhere upcoming where people can find you and reach out and hug your neck?
So by the time this drops, I will be getting ready. Actually, when this drops, I think I'll actually be on my honeymoon. So, but right
Okay.
after, I be in Turks and Caicos. So when I go to Under One Roof, I will be speaking a women's wellness program. And so anyone that's going to be there, please come, because I'm really, really proud of this presentation that I've been begged to create for a while by Andrea Johnson. And it's really special. And if you know me and you've heard me speak, or you've put up with me as I come in and consult, you know that I really, so much of my programs is about systemic health and then our role. And it's really special. I'm super excited. So come see me. And then, of course, I have credits and Southwest Dental Conference. We have FAAOSH is going to kick that off on that Thursday. So both of those are in August. So thank you
Awesome.
for asking.
Absolutely. Yeah, because we travel and we ping pong across the United States. And it's like, okay, where can I find them and actually see them speak? So thank you so much. And thank you for sharing your journey. And anyone who wants to reach out to Machell, again, in her show notes. And for our listeners, thank you so much for supporting our show. And I always ask for a favor from you to like and give us 5 stars on Apple Podcast, and go on over to YouTube, like, subscribe, and share with all the people who you love in your life. And thank you so much for the smiles that you give, the help that you help to instill in other people and your patients. You guys, I appreciate your support. And until next time, we will see you on the flip side. Thank you, my friends. Bye, Machell.
Thank you. Bye.